Hello again. I want to talk a bit about the NHS today. For the first 40 years or so of its existence, the National Health Service in Britain was marvellously efficient. I remember those days. You could go and see your doctor in the morning and he would see you immediately. Hospital appointments typically took place the following day. Since the mid 1990s, though, the NHS has begun to fail. It's creaking, and however much money we put into it, it continues to deteriorate. Politicians of the left and right constantly claim that they're going to fix it, but none of them seem able to do it. And this is because nobody will speak openly about what the problem is. Everybody knows what the problem is, but there is a convention that one must not speak out loud about it, let the cat out of the bag, as it were. To see why the NHS is in such difficulty, let's talk first about when it wasn't in difficulty, when the NHS was working fantastically and it was the envy of the world. When the National Health Service was set up in the late 1940s, it was designed to cope with the population of the country. That is to say that so many doctors would be trained so that there would be one GP for so many thousand people, and hospitals were built so that each hospital would cater for, again, so many thousand people. So the system was fixed to handle a stable population. During the 1960s, things improved for the NHS. Its service became even better, and the reason was that the population was declining slightly. So in 1967, 225,000 people came to Britain, but 309,000 emigrated. That meant there was a slight decrease in the population. The natural increase, that is to say the number born against the number who died, was also pretty steady, because the tendency was to have fewer families. The pill had become available, so there was free contraception, small families, more people leaving the country than arriving, which meant that the NHS worked perfectly well. This all continued until about 1990, and then things began to go wrong because more people were arriving in the country than were leaving. And many of those that were arriving were having larger families than those already living here. So instead of the classic 1.5 children, they might have 6 or 7 children. So in 1990, the population of the United Kingdom was 57 million. At the 2011 census, it had gone up by about 6 million, so an increase of just over 10%. Of course, Britain hadn't built 10% more hospitals over that 20-year period, nor had they trained 10% more doctors. So each of those GPs that were dealing with a certain number of people would now have to deal with more people. The hospitals had to deal with more people than they had been designed for as well. Since 2011, when the last census was taken, the population has continued to grow rapidly. And the increase isn't distributed evenly around the country. So when a family comes to Britain, it's not the case that they're as likely to move to a village in Westmoreland or to a small city in Cornwall like Truro as they are to move to London or Birmingham. In fact, most people coming here to the United Kingdom want to live in big cities, which means that the NHS services in London, Manchester, Leicester and so on simply can't deal with the rising numbers. That's why at one time you could go to your doctor and he would see you that same morning. And that was literally the case. You didn't have to ring for an appointment. You popped down to see the doctor in the morning and he would see you within an hour or so. But these days, you very likely to have to wait 3 weeks, even for an appointment to see the doctor. Another problem is that many of those coming to this country, many of the families have members with pre-existing health conditions, often quite complicated health conditions. Some of them don't speak English and none have paid national insurance contributions. This means that the books don't balance anymore and the NHS teeters on the brink of bankruptcy. There's no point anybody here writing a furious comment to the effect that many NHS workers are foreign and that we need them vitally. We need these staff from abroad because we haven't been training enough doctors and nurses ourselves, because it's cheaper, rather than training them, just to poach them from abroad when someone else has already paid for their training. It's iniquitous because it deprives countries like Pakistan and India and various countries in Africa of doctors and nurses that are trained there. But it's certainly cheap for us. They wouldn't be needed in any case if it were not that the population of the country were rising inexorably year after year. As I say, nobody ever says this out loud. It's the elephant in the room. Whenever people discuss the NHS, no one will discuss the real reasons why it's in trouble, although everybody knows. There's really a very simple choice. We can have unlimited immigration, or we can have a national health service. One or the other, but not both.